Well, good evening, everyone. So, my name is Lindsay Harris. I am a family nurse practitioner and assistant professor here in the state of Alabama, and I am so excited to be here. I recently also finished working in or serving in Congress, I should say, with Representative Lauren Underwood by way of the Robert Wood Johnson Health Policy Foundation, the Robert Wood Johnson Health Policy Fellowship. And this is such a great time for nurses. And so thank you so much for being here. And Courtney?
Thanks. Good evening, everyone. My name is Dr. Courtney Pladson. I'm also a family nurse practitioner. I currently am I live in the state of Maine, and I'm our state's Medicaid medical director. I'm the first nurse practitioner in the state to be a Medicaid medical director and only the second in the country. I work in our state's leadership, and I'm really excited to talk about policy advocacy work. I also work clinically 1 day a week in my local healthcare for the homeless clinic, and I've worked in FQHCs and healthcare for the homeless clinics for the past 13 years. And that's really where I started my advocacy work. Once you work in the safety net and you start to see all the problems in our systems, our healthcare systems, our insurance systems, our housing, food, once you start opening your eyes, it's hard not to start getting involved. And so I started doing local advocacy, talking with our city council members and advocating for housing. And I'm really seeing myself as part of the movement to end homelessness. Prior to my work in Medicaid, I worked at the National Healthcare for the Homeless Council, where I worked on the federal level. The council supports the 1,400 federally qualified health centers across the country, really improve the quality of care provided to people experiencing homelessness. And in that role as the medical director there, I worked across the federal government with HUD and the VA and the CDC and HRSA, really started to understand the levers of government. And so I've had positions now at the federal level and at state level, and I'm really passionate about advocacy work. And as someone that grew up on Medicaid, lived in Section 8 housing, on SNAP benefits, TANF, you name it, I was held up by the safety net. And so these are not theoretical for me, these are personal. Uh, and I feel so important. This conversation is so important. I'm really glad to be with you all this evening to really talk about how we really can be part of a movement and build a movement together. I would turn it back over to Lindsay.
All right. So listen, thank you all so much for being here. As I mentioned earlier, what a time for the most trusted, the foundation of healthcare profession to mobilize together and come and join together and just be a force in our United States government. So next slide, please. So as you all know, I have the mission of a nurse shift change is really just to just mobilize, nurses across the country and those who support the profession of nursing to, I apologize, to mobilize allies and shift the direction really of healthcare and justice in America. So our theme is, humanity, ethics, and social justice for change. So what is Nurse Shift Change? It's really a nationwide movement led by nurses. It began or it was born with the urgency of the times that we are in now, with the political and social and healthcare crisis that we are facing. And we really believe that nurses, the most trusted profession, can lead this systemic change. There's one quote that I heard and have heard quite some time is, those closest to the problem are closest to the solution. And I know that we as nurses, we are definitely closest to the solution. So we definitely should be at the table. So as it relates to the rally, we have a main rally. It's going to be in Washington, D.C. this Saturday, the 24th from 10 a.m. But we also will have satellite rallies in the state of Washington, Chicago, Georgia, and Connecticut. So why does advocacy matters? So, number one, I think the main thing is understanding our value and knowing that we are the most trusted profession and know that we are the foundation of healthcare. If there were not nurses in healthcare, there would be no healthcare. So understanding our value and understanding that we as nurses, we really experience the impact of policy firsthand. Also understanding that policy truly impacts our profession, but not only our profession, it impacts those that we serve, and it also impacts the equity that runs throughout healthcare as well. And nurses, we have the ability to shape policy. There are 4.7 million of us here in the United States, and if we join together, we can truly impact and improve the health of our nation.
All right. So we, as part of this movement, developed a policy brief. And we want to talk a little bit about what a policy brief is and how we can actually use it. So I'm going to walk through the policy brief. We brought in the pillars of nurses shift change. And really, this is a tool that you can use to advocate to your leaders, your congressional delegation, your senators, even your local council members, your state legislature. This is a tool that you can use and really help to amplify the message of nurse shift change. But here's what's really key. We have to make this a personal message. We have to help legislators understand what is happening and what is being proposed in Congress and how that's going to play out in our communities. You as nurses know now you have that patient, you have that hospital, that clinic, you know the community that's going to be impacted. And so helping to translate the impact of policy is where nurses can be really the key here. So I'm going to walk through this policy brief, and then Lindsay and I are going to give examples of how we would use this policy brief as an elevator pitch to our legislatures and our delegation. So the executive summary here is that the Trump administration budget proposals include sweeping cuts to healthcare programs and agencies, threatening the backbone of America's health system, nurses, us. These proposals now under consideration in Congress would slash funding for Medicaid, eliminate programs that strengthen the nursing workforce while gutting primary care and community health resources. This is dire. Nurses are the largest segment of the healthcare workforce, and our ability to deliver safe, equitable care depends on the targeted investment, not disinvestment. We need investment further upstream. So the key issues, there's four. Direct threats to the nursing workforce, cuts to Medicaid and Medicare, undermining primary and community health, and then what is our actual call to action? So I'm going to walk through these three pillars. So the direct threats to the nursing workforce. So what is being proposed is eliminating the National Institute of Nursing Research. It's the only body within NIH that looks specifically at nursing research. And what's so important about nursing research is this is translational research. This is what we can implement right away. This is what really directly impacts people's lives. So impacting and dissolving the NINR would have negative consequences on patients immediately. Terminating the nurse faculty loan forgiveness program is another proposal. We know nursing faculty are underpaid. We know there are not enough nursing faculty. These programs are essential at recruiting and retaining faculty. Without this, we know that the numbers of nurses that we could train will continue to go down. And that's the reverse of what we need. We know we're facing a nursing work shortage. We need more nurses, and therefore we need more faculty. Cuts to workforce development programs. The budget slashes Title VIII nursing workforce development programs that fund scholarship, advanced training, rural and underserved placements, which are critical tools to recruit and retain nurses across the country. I live in a rural state. This is a big deal. We need these incentives. We need these programs to really help people in under-resourced communities or communities that have that critical access hospitals or those that do really struggle to recruit and retain workforce. And we all know each of these could lead to exacerbation and burnout, which will lead to more staffing shortages. We saw this in the pandemic. Our workforce is already strained. We need more help, not undercut to what we're already trying to build back. All right, this is the big one, cuts to Medicaid and Medicare. So just today, Congress put forth a bill. They passed the bill in the House and it's moving over to the Senate. What is being proposed is and will be devastating if this goes forward. We need to really help legislators understand what this impact would be in our communities. And I'm going to give example of that in a little bit of how I would relay this to my main delegation. Additionally, they continue to say that there are not cuts to Medicare, but the Congressional Budget Office just this week said the administrative cuts that they're proposing in terms of decreasing the workforce that supports Medicare would equate to Medicare cuts and people not being able to use the benefit, struggle to access resources. And so indirect, so they're trying to get around this politically, but this would harm seniors and those with disability that are on Medicare. These are not proposed, these are real harm that would be caused. Number 3 is undermining primary care and community health centers. So community health centers are our safety net. They're the place that when you do not have insurance, you're underinsured, you can go and get wraparound care. When there's nowhere else to turn, we know that people go to health centers. These health centers deliver frontline care to over 30 million people in rural and under-resourced communities. Budget reductions result in clinic closures, reduced hours, and loss of access to preventative and chronic care. We know if our health centers close, that's only going to overburden our emergency departments. Anything we cut upstream is going to have more expensive downstream effects. Erosion of our public health systems. Public health departments are essential for disease prevention and control, promoting healthy lifestyles, ensuring safe food and water, and addressing environmental hazards. The cuts to CDC at the federal level and the cuts to local health departments will be devastating. Can't score this enough. And then cuts to primary care research. Eliminating or underfunding NIH-affiliated institutions will limit innovation and community-based interventions, and especially this emphasis on health equity research. All right, if this isn't making some fire in your belly, we've got to make sure people are understanding how these proposals could harm our communities. So here's the call to action. This is what we ask our representatives. Protect and expanding nursing workforce programs. If you're a professor, you can help hone this message. This can be something that you really hammer home and help them understand. If we don't have nurse faculty, we can't continue a pipeline of nurses. Oppose cuts to Medicaid and Medicare. These programs are lifelines, not luxuries for millions of people. Gutting them will widen inequities and overwhelm already strained hospitals and clinics. And number 3, the ask is defend public health and community-based primary care. Sustain funding for public health development departments, health centers, and federal research that supports innovation and local care delivery. In conclusion, the 2025 budget proposal abandons the nation's frontline healthcare workforce and undermines decades of progress in health access and equity. Nurses are sounding the alarm, not just for ourselves, but for the communities we serve. We urge legislators to reject these cuts and invest in healthier, more just future. All right, so this is the policy brief. Now we can use it, you can send it, you can use it as an email, and then personalize it. This is where we want to spend some time talking about a local context. So all politics are local. If you call your legislator and you're talking about what's happening in the national level, they're like, okay, that's cute, but what's happening in my district? How does this actually relate to my constituents? And so this is where this is really important. So, because this bill just passed Congress, I would want to talk to Susan Collins, my senator. She represents the northern part of my state, which is the more rural, more poor, older part of the state that specifically would be disproportionately impacted. So Republican senator. So I need to appeal to my Republican senator in her district. So if I tell her I'm from Southern Maine, she's not going to be interested. So I have something that if I'm not her constituent, I need to say, I serve patients in your congressional district and help her understand how it could impact her constituents. So here would be my elevator pitch. Hi, Senator Collins. Thank you so much for your time today. My name's Courtney. I'm a nurse practitioner and I serve patients across the state of Maine, and particularly those in our safety net and those that are living in poverty. In your district, in District 2, there are 12 critical access hospitals that are at risk of closures if we cut Medicaid at all. They're already struggling financially. And if we lose those critical access hospitals, the constituents in your district will have a harder time accessing care. Recently, Inland Hospital closed, and Holton Memorial had to close their labor and delivery unit. And now for District 2 residents, they have to drive 3 hours to the local labor. That's their closest labor and delivery unit. I'm really worried about Medicaid cuts. Not only will they impact access, but they'll have huge economic harm in your district. Hospitals, rural hospitals are really an economic engine in rural communities. Those physicians and nurses are some of the best paid individuals in your community. If that hospital closed, that'll have a devastating economic impact in your district. Senator Collins, I urge you, please defend the nursing workforce. We need this funding to maintain a nursing pipeline for rural communities like yours. Please defend Medicaid and reject cuts to Medicaid and Medicare that would disproportionately impact your district. Please defend public health. We need to protect our water, have clean air, and we need to make sure we're have tools to prevent against illnesses like measles if they come to Maine. I'm a nurse. I'd be happy to talk to you if you want to learn more. Here's my contact information. Let me know if there's anything I can do to help as this bill evolves. Thank you so much for your time. So that's my elevator pitch. I want to make sure it's relevant. I want to make sure she knows the expertise. I want to hit on access. I want to make sure she understands the economic impact. We have to help people understand how it hits people's purses. And this could be devastating in her community. So I'm going to turn it over to Lindsay to talk about Alabama and how she would frame this for her delegation as well.
Yeah, thank you, Courtney. So the first thing I will say, what Courtney just did as far as catering to who she is talking to. So it is always so important before you even get started or before you meet with any representative or senator is to know a little bit about their background, know who they are, look at some of the legislation that they have passed or things that you've seen them vote for in the past. That is extremely important. And so she just mentioned she was talking to a Republican senator, and the key things that she mentioned was, workforce, the economics, job, those type of things are very important. So in the state of Alabama, much like Maine, except the state of Alabama, we actually have had 19 hospitals that have closed and 27 additional hospitals that are at risk of closing. So most of your legislators or most of our legislators already know this, but it is our job to really talk about the implications. So one of the things that I would also talk about, since one of the things that I have learned most recently, or that I learned, working with Representative Lauren Underwood, is we talked about maternal deaths and, Black women being more at risk. Well, we have 67 counties in the state of Alabama. Of those 67 counties, 55 of them are rural. And the majority of the counties are in maternal deserts. 90% of the constituents that live in rural areas, it takes them 90%, it takes them 30 minutes. So those things are very important because we want, when we're dealing with, workforce, we're dealing with the health of our children, we're dealing with, mothers. It's going to be important. And so when we talk about cuts to Medicaid, a lot of the individuals are on Medicaid, which leaves them without care. Here in the state of Alabama, we have not expanded Medicaid. And so it leaves them without care. And so those type of things, kind of making it real to them and getting them to understand that, the areas, or your district, the areas that you represent, is of the 67 counties, it's 3 counties, and all 3 of your counties are rural. And so I think just number one, making sure that you understand who you're talking to, making sure that it is absolutely relevant. And then Courtney did a great job at the end of saying, listen, I am here, I am a nurse practitioner. This is my position here, and I can be a resource. Always offer yourself as a resource.
Right. So for nurses shift change, here are the key messages that we're amplifying. And Danielle keeps reminding me that this is the, I think, 70th anniversary of the Nursing Code of Ethics. Is that right, Danielle? Is it 70?
75th.
75th, thank you. And these messages are not very partisan. These are nursing ethics. This is what we've all committed to, that healthcare is a human right, that nurses demand ethical policies rooted in humanity and science. We stand against systemic injustice and health inequities. Advocacy is a part of nursing. I don't know where we lost that along the way, but this is an essential part of our role. We are clinically, we are advocates. Come hell or high water, my patient's going to get what they need. I will call the PA. I'm going to call nursing leadership. I'm going to call hospital leadership. I advocate for my patients for housing all the time. We have advocacy in our toolbox. We just aren't using it around policy and advocating for change in this way. And if, as Lindsay said, if 4.7 million of us can really take this advocacy and create this movement where we're actually advocating for systemic change through policy, we are going to see huge changes. We will. So we really need to use those collective voices to drive change. So the other thing what we're going to do is walk through a little bit of the toolkit that we developed. And this is really simple, but we want to make sure folks know the resources and how to use them. So first and foremost, you have to find your senators and representatives. So we're focusing here on the federal level because that's where the things are happening in the moment. And we also know that we're getting towards the end of most legislative seasons for our local state governments. And so we're going to work on that for next year, okay? But right now we're focused on the federal level. So here are links, and I think the advocacy toolkit was sent out, and we can include links for this as well. But here are some different nonpartisan organizations that you can utilize to find your reps. So find your local, you can put in your zip code, find your representative, find your senators. Then when you think of reaching out, here are some pro tips. So you want to make sure that you tell them that you are a nurse, tell them your role. I've sat through many state hearings, and when someone says they're a nurse, people listen. It really makes a difference. Your voice matters, and those HHS committees sit up a little bit. They're like, oh, they're going to have something important here to say. Just because you haven't done it before and you might not feel confident in it doesn't mean that your all of the expertise you're bringing to that testimony isn't valued. It is. Nurses are the most trusted profession. When nurses are speaking about something and advocating, people listen. So your voice matters, and we have to get it out there. As Lindsay shared, we want to make sure that you're telling them that you're part of their constituent, so you're in their district or state. Make things personal. So whether you're sharing a patient's story, sharing your role, sharing your expertise as a professor, as a nurse practitioner, as a nurse, you really want to help them understand what is the context in which you're sharing and what you're speaking from. And you want your specific ask. And so using that policy brief to have some specific asks is important. So make it personal, make sure they know you're a nurse, and then know your asks. Often people will start sharing a story and then not actually land the punchline. And so in some ways it's helpful to say, we want you to defend Medicaid. We want you to support our nursing workforce and support primary care and public health. Share your story and then repeat your ask. These are tools that you could, once you practice, you can get more confident in them. So, I thought there was a second part here. Okay, in the advocacy toolkit, there is some additional information about how to schedule a meeting with your federal representatives. Your Congress folks and your senators have offices in their districts. So you don't have to go to DC to have meetings with them. You can set up virtual meetings. In-person meetings really are preferable. You can make that person-to-person connection. It makes a difference. It's harder for them to ignore you when you actually meet them in person and you see them in the grocery store later. You're like, I know you know about nurses shift change. You remember me, right? How'd that go? Conversation with the senator go, So it makes a difference. Meet with them in the district if possible, if you're not able to make it to DC. And then we send out email templates for you to be able to talk about nurses shift change and create. And really, it's a template. We don't want you to copy paste. We want you to put some personal context in terms of your role. Nurse Lindsay, I just want you to see if you could speak to this a little bit about how in a congressional office, the difference between kind of a personalized message and just an automated message from a lot of people. Can you speak to the impact of that?
Yeah, absolutely. So I will say this, that your letters are being read. So whenever you send any type of information, any type of correspondence, or even when you call the offices, that is taken into account. But I will say that legislators, both at the state and the federal level, they really would prefer stories. They would prefer, true data, and things that really impact their districts and their constituents and those that they serve. So that is why it is so important for us to really personalize the letter, and so that they can really get to know you. And don't be surprised if they reach out to you just to gather more information. One additional thing, Courtney, I was going to say
Mhm.
was, and please do not be offended if you do try to per se meet
Mm.
with the actual legislator,
Oh, yeah.
and they're unable to meet with you. I will tell you, just working in the offices, that the staff play a humongous role in writing of the legislation, crafting the legislation, gathering the information, and hearing from us, as citizens, as constituents, as leaders within the community. So I think that is very key to really take note.
And Lindsay, can you speak to a little bit about the roles of the staffers? Because often staffers have like, they're the lead for healthcare, they're the lead for different components. And so do you mind just sharing some of that nuance there? Because I know it can feel like you're getting kind of a stiff arm, but actually you're meeting with the person who is the subject matter expert.
Absolutely. So, say we are doing something with like Medicaid, or Medicaid and Medicare. There they do have staffers, as Courtney just mentioned, that strictly look at, and all they do is health topics. We have someone that all they do is defense. They have staffers that look at different things like nutrition, like the Farm Bill. So it is. And I will say this, sometimes, so I was there as a fellow working with a one of the health staffers. A lot of times that is okay, because you don't get a higher level, because you don't speak with the chief. 9 times out of 10, or I can speak for the office that I was in and a few other offices, information is summarized. So it's always good to follow up with an email of quick bullet points, because the information is truly summarized and really sent to the congressional member. And then they look over it, and that's how they decide, let's support, let's not, let's create legislation based on XYZ. So follow up with an email too. I cannot stress that, with just bullet points, so that they can really understand, who you are, and what you're really advocating for.
That's great. Bullet points and then references. I like to send those too.
Yeah.
Um, the other thing is, I always think sharing a personal story is really helpful. It helps to really land how this policy impacts humans. And that's really, we want to make sure we're keeping the humanity as a part of this. One of the ways that this proposed legislation right now, or the bill that's passed in Congress today, it really targets the Medicaid expansion population, which in my state is disproportionately people who receive substance use treatment. So it's often single adults. And so in Maine, one of the things that I have been stressing to our delegation is that my patients, I'm a board certified addiction specialist, for the patients that I treat for substance use disorder, for them being able to use Medicaid to be able to stabilize their substance use disorder, engage in treatment, engage in recovery, they've been able to move forward in their life. That is one of the most important pieces of stabilizing their health, so that way they can move forward in their life. And for many people, without access to substance use treatment, they wouldn't be able to return to work, not able to reunify with their children and family. And so the loss of Medicaid for this population, I am terrified that many, many people will lose access to substance use treatment. In this progress, we just saw a 20% reduction in overdose deaths. Massive after many years of sustained progress and mounting and developing and capacity building resources to treat substance use disorders. If we now defund Medicaid for this population, we're going to see huge reversals of those gains and many lives lost. And will actually, again, prevent what people are saying, purport to say their actual goal is support people returning to work. These people are, many of them are working, but without that treatment, they won't be able to work. Healthcare is a human right. It should not be based off of work capacity. I want to make sure that's clear. But again, if we take away healthcare, this will have devastating impacts for people's life and make it actually harder for people to engage in work. So key here is that movement building is a marathon, not a sprint. What we're starting now with Nurses Shift Change, this is the start. This is the start line. It doesn't end with the rally on Saturday. This is just our opportunity to start seeing each other and say, oh, I see you, Lindsay, in Alabama. You're doing your thing. I'm here to support you. Call me if you need anything. Danielle, how are things in Baltimore? What do you need? Where do we show up? How do we support each other? And we start building this network. It builds. These movements are like waves. They take time to build. You need time to build momentum, to build a movement. This is the start. It's going to take time. We have to train nurses. We have to help nurses harness their voice. We have to help nurses understand policy, understand it at the state level, the federal level, where to get involved, what are our asks, and how to create this movement together. So we got to figure out a way to sustain ourselves. We got to hold each other up. We got to know that if Danielle needs to take a step back, Lindsay and I are there. If I need a break, Lindsay and Danielle are there. So we got to hold each other up. We got to know we need breaks in this. That's how we're going to make this a movement and work towards change over the next many years as we do this together. So we want to take down the slides, open things up for questions. We really focus this in this moment on the federal level. We know that we likely will want to do more webinars over the next year, thinking about all the levers of change on the state level. How do we get involved on the local level, city council? There's lots of ways to get involved. So we really just want to start in this one small piece in this moment where things are really happening on the federal level. But we're open to questions and would love to hear people's really situation on the ground of where you are, how you see yourself being able to use this toolkit, being able to use the documents we've shared. So I'm going to take down these slides.
Dr. McIntyre?
Hello, great talk. So I just had a sorry, I'm in a meeting. Just a clarification question. So the policy brief for our chapter, are we able to just take that and give that to our elected officials when we have our rally? Because that's what we've been doing with other things. Okay, so we're good with that. Okay, and just
absolutely
rating. And when we do our closing speech, we can highlight the points for them at that point.
Yep, that's great. Yeah, it's something you can hand out to folks. You can share your story as a part of it. Absolutely, those are all resources for you to take and make your own.
Okay, thank you.
I have a question. So where is the best place to get some of the facts that you put into your policy brief or into your elevator pitch?
Good question. So good on the national level, places like the Kaiser Family Foundation, they have wonderful up-to-date information on what's happening right now. And so I can put that in the chat. They have like tracking up the provisions in real time. So let me, so even, just based on what was amended and passed in the past 24 hours, they've already updated it. So it's nice to have resources that you can go to that are just rapidly evolving. So that's one. In the state, I mean, that's really going to be the state dependent. There was just an assessment in Maine, and I'm curious if this was what Lindsay was referencing too, but there was a report that came out nationally about rural hospitals and that are at risk of closing. And so that is the one that we can elevate and share as well. I'll put that in the chat.
I'll also speak up and say this. So your local, like your health departments,
Yes.
the hospital associations, all of those, that's where a lot of my data, right? So that's the information that's really related to Alabama. And they will have a lot of that. So the health departments especially, but the hospital associations as well. That's a good question.
Mm-hmm. This might be too in the weeds, but I'll just say, as a part of the Affordable Care Act, all the hospitals are required every few years to do a community health needs assessment. And it's a really great way to find really local information around inequities or challenges like disproportionate chronic illnesses or housing or whatever health-related social need that is happening in your community. So that's another way. If you just Google like your county and community health needs assessment, that those will come up. Yeah, thanks, Crystal. Yeah, a lot of that data from the public health is reported, like they have annual reports that they're required to put out. So those are really great resources that are very up to date. So thinking about other levers too that you all can think of as we move forward, we put in this in the toolkit, but writing op-eds, getting this message out to other nurses and the public. This is a good way to get your voice out there, help people see you as a leader in this space as well. We do that a lot as we can pair that op-ed with proposed legislation so they can have a nurse perspective alongside to understand the impact. And then other pieces are practicing actually going in front of legislators to testify as bills come up. So in your state, there's often options to do it virtually, so you don't have to go to your state capitol. But this is where trying to have some local movement around what is being proposed around workforce, around funding. And that's where I see so little engagement on the state level that I would really love nurses to be able to really mobilize around this, whether it's your nurse practitioner chapter or your nurses, or it's Nurses Shift Chains creating this, because this is really a space that that there seems to be voids across the country. So how do we help step into some of these spaces and the state level too? Sarah, I'd love for you to share more about that. Brianna.
Hi, good evening. I'm Brianna. I'm the health policy co-chair with Dr. C in Rochester, New York. Thank you so much for putting this all together. I'm really excited about Saturday. I did have a question regarding the policy briefs. I know that we're all representing, the US, so there weren't any specific bills on there, but would it be okay that we incorporate our local bills
Absolutely.
for representatives?
Absolutely. Yeah,
Okay. I just wanted to make sure.
Yeah, no, that is a tool that you can use. Go ahead, Lindsay.
So one of the things I wanted to ask you, Brianna, so you said incorporate your local bill. So absolutely, unless it's a state bill, right? So what you have to understand is it depends on who you're talking to, right? So if you're talking to a federal legislator, then putting one of your state bills there, they really don't have much impact, right? So if you're talking to a state legislator, though, obviously, yes, you put one of your local bills. Does that make sense?
Yes, it does. Thank you.
And you could adapt that. So that policy brief is also an example that you can use and modify. So the ask was specifically to Congress, right? But you can say to our state representatives, here are the asks, and you can still use that structure around workforce, around public health and community health centers. Like you can use that and adapt it as well. So that's something that you can modify to your local context if that's helpful.
So I did want to quickly respond to that. Because this is a movement, I think that could be a part 2 of what we do, that we don't have to alter it for this one, because one of the things that we're trying to do is have some uniformity in what we're saying and doing. So we'll probably in our chapter do something separate to meet with those elected officials, but we probably won't alter it for this March because of the nationwide aspect of it.
That's great. That's helpful and interesting to think about. Yep.
And let's see, Sarah asked a question
Mhm.
in the chat. And the one thing I say is, and I'm not sure if you're constituents of any of the individuals that voted to cut, but as a constituent, you have a voice and you have power. So it is, okay, it is in your interest and right to say, to write them and say, you know, I noticed that you voted against XYZ. You know, I am a constituent of yours, and this is exactly how it's going to impact, you know, your area, etc. I would love to continue to talk about this. And I think that would be impactful. Not that you're going to change their idea or their votes, but I will say that it is, I mean, you essentially voted them in. Not you, but you know what I mean. Like, you as a constituent, we voted them in and we can vote them out. So just asking the question and truly understanding why, and giving your reason or just information about, like, this is how it's going to harm your area.
I want to respond to Danielle's question here, and I welcome others too as well. Rallying is so important. I'll just share. Last week, I was at the Healthcare for the Homeless conference, and I've been working in healthcare for the homeless organizations for the past 13 years. At the end, we always have a rally, and we really identify as being part of the movement to end homelessness. And we rally with consumers, people with lived experience of homelessness, with advocates, with healthcare providers. And we rally, we cheer, we support each other. People share their stories and really focus on why we are doing this, because housing is a human right, healthcare is a human right, and we emphasize that over and over. Rallying is so important because it fills our cups too, and know that we're not alone in these fights. Like, we all are doing our best in our day jobs, and we give our most to it, whether that's educators, whether that's healthcare providers, whether we're leading in other systems. We are all doing this work, and it's exhausting and it's overwhelming and it's stressful. But when we get together in person and we say, here's what we're fighting for, it helps us know that we're not alone in this work. And again, we can't fight ceaselessly, but we can fight together. And that way, I know that when I need to step back, I have all of you. And when you need to step back, you can turn to me. And that helps sustain us in this work. So, yes, we don't know how many people are going to turn out. That's okay. If there's 2, if there's 100, that's wonderful. Next year, there's going to be 1,000,000. But in the meantime, we just need to show up for each other. And that's what this is about. It's about saying, this is what we stand for. We're not alone in this. There are many of us that believe in these values, and that we're going to come out here and we're going to vocalize them, and we're going to support each other in this work.
Yeah, and you know, for me, one of the reasons why I joined the nurses shift changes is really because this is really a movement, a mobilization of nurses without history. It is nurses that that truly want to see change within the country and within our profession. And you know, I think that just a fresh look and voice is absolutely super important. And to the next
Hello,
question,
this is Ruby.
and to the next question, as it relates to rallying, you know, there's power in numbers. I mean, that's simply put, right? If just imagine if all 4.7 million of us voted, and we voted in the same way, just imagine we would be running the country. I love nursing. We would be running the country. So that's why rallying is important.
Sorry, I guess I could respond slightly. If that's what you guys wanted me to do, on mute, right? Okay, so I guess for me, it's really an extension of what we do on an everyday basis for our patients. We know that in terms of the advocacy and the work that we do, it doesn't stop at the bedside, and you know, a lot of policy impacts them. So continuing to do the advocacy work is just an extension of that care. And then in terms of rallying, I definitely think that it's just one aspect. Okay, it's not, it's just one piece of the puzzle in a sense. There's writing letters, there's doing statements, there's having these different events, there's follow-up letters, meetings, etc. But I think that you have to, similar to treating a patient, sometimes you have to have that comprehensive approach where you're, giving them meds and, therapy and whatever else. It's kind of like that same thing. So we just have to come at it at various different angles to see what kind of sticks.
Right. Yeah, we want the multi-pronged approach. We want to do all of it at the same time. And we should have joy. We should spread joy. We should lift each other up too. We want this, the rallies can be celebratory. There can be music. There's things to celebrate in the movement and the people that are doing this. And we have to hold on to joy in this as to sustain ourselves. That is such an important point of movement building, is to find the joy in this as well. There are bright spots. There are people doing beautiful work that are holding the line in lots of different ways. And so we can't lose sight of that piece too. We can't, we see in movements where the expectation is people are working ceaselessly and there's no joy. They're not very successful. So we have to hold on to joy. That's really what helps to sustain people. But these rallies should be fun. They're a rallying cry. We cheer, we yell, we sing. These should pump us up as well. We don't want to lose that piece. Yes, Michelle, go ahead.
Good evening, everyone. I want to say, Courtney, that our rally on Saturday is going to have a very festive approach as well. I spoke with Danielle earlier today, and Shelly Ann McKenzie has assembled a pop-in playlist. We intend to make noise.
Yes.
We have a venue that's inside, but we're going to really try to do as much as we can outside, because we want to raise our voices. And people who are driving by, people who are passing by, the intention is to really get individuals activated. And on a call that we were on earlier, I made it very clear to a young man who is looking to become an advocate that advocacy is not specifically for nurses. And we have to keep that in mind, that what we're advocating for is not specifically nurses, because nurses are fine. We're going to be fine. We've got jobs, health insurance, this, that, the next. We are advocating for the patients, for constituents, for citizens, their families, their communities, and we really want to show them that we mean business, but we're also celebrating the fact that we are coming together, we're unifying, we are no longer operating in silos. We have them in the forefront of our minds and our focus, and just to attract people in every way. Courtney, you talked about a multi-pronged approach. The multi-pronged approach is truly making sure that we get citizens involved, because as many as there are of us, and we have the opportunity to decide who's the governor, the mayor, the president, there's enough of us, but there's a whole lot more people that depend on healthcare, that care about healthcare, and need to be educated on what they should receive as a right and not a privilege. And it behooves us to make sure that these rallies are really getting the everyday folk there and in full. So if you got to do boots on the ground line dance, backward, forward, and 50 ways till Sunday to get them out, and fabulous snacks, and big voices and yelling and placards and whatever, then that's what we do, because it's for them and we need them as well.
That is so beautifully said. Thank you so much for sharing that. You are 100% right. Nurses are leading this, but we're not doing this alone. We can bring everyone with us, our community members, our kids, our partners, our mom, we're leading, but we're bringing them all with us. My boys have been to many a rally, and they will continue to come with me because they need to understand and learn this too. Beautifully said.
Crystal asked a question about any tips on handling the press or the media. So, one of the things I say, and this is a very good question, is, I think number one, identifying someone in your area or, someone at the rally to speak. If that person is you, identify the 3 points. So on the policy brief, Courtney's created a great policy brief as far as this is what we're here for. So talk about the 3 points, maybe give an example of the 3 points, and this is what we want. So utilize the policy brief. It is such a great format for you to send to legislators, but also utilize in the media. We also talked about in the toolkit where you can write an op-ed. All of the information that's there is super helpful, but that policy brief, identify 3 topics, 3 basic topics, and say, this is why we're here, 1, 2, and 3. This is how it's going to impact us, 1, 2, and 3. And this is our call to action.
And I'll also just recommend practicing it. If I'm going to give a public speech, I will use the like memo or voice record or something on my phone, and I will practice projecting it and practice saying it. It takes saying it a few times so you feel comfortable. What is it in a formal written language feels different when you try to just say it naturally. And so I just encourage you to take the 3 points and practice saying them. Practice to your partner, practice in the bathroom. I practice mine in the shower, and I just record them just to see how I sound back. So whatever tips and tricks you need, but just practice saying out loud. It helps.
Dr. Nelson.
So the other thing that I want to say about this, and Lindsay and Courtney, you may think differently, but my thoughts on handling the press, and I do need some guidance on this, I think we all do, is that we also had to understand the approach that we're taking when it comes to events like this, and to make sure that we start by also saying, and I don't know if we want to put this into the script, that this is a non-partisan situation.
Yes. Yes.
Okay, it is extremely important. So we can sit here and we can go on and on and on and on and on about this administration, that administration, this is unfair, that's unfair, but it has to be behind closed doors, because when we're public facing, especially if you live in a state like mine that is ultra conservative, you don't want to give the media an opportunity to create a narrative for you that is going to be in front of and supersede all your other messaging. Healthcare is for everyone. It's not for Democrats. It's not for Republicans. It's not for this, it's for that. It's for everyone. This messaging is to make sure that everyone is receiving healthcare as a right and not a privilege. So as much as we may want to go off and pop off and get lit and say this and say that on Saturday, I think we need to be a little measured and reserved, and to think clearly before we do or say certain things that could be perceived as, uh-oh, here they come, by whomever is listening. And stay focused on the facts and the statistics, because facts and statistics and issues do not lie. Do not allow your personal whatevers to come before what the purpose and the focus is of these rallies. Because once you are painted with a certain brush, it's hard to unpaint, unring a bell. So be very careful and measure with what you're saying, as well as crowd control, what you're allowing the crowd to do as well, because you might be standing up there and the crowd goes left. We had to be able to reel it back in and say, okay, this is not the time or place for you to use this as your own personal gripe session. We are focused on healthcare and healthcare for all. All right, so Lindsay, Courtney, I don't know how else to say it. I'm trying to say it as best I can, but you guys know where I'm going with this. Courtney?
No, I don't disagree with you at all. I think this is where knowing all politics are local. You know your context, you know your community, you know your culture and your community, and that is really important. What is perceived as middle of the road here in New England is going to be really different than Alabama. And so knowing, sticking to this messaging that we were really intentional about this messaging and really trying for it to be as apolitical as possible and really saying, this is our code of ethics. This is what we do. When we are serving our patients, we're not asking for their political affiliation at the door. This is not what we do. We want healthy communities. We want to serve everybody. And you can use that as part of your messages. You can say we are not part of it. We aren't aligned with a specific party. So those are things that you can emphasize too. But don't get me popping off about certain topics. I'll get myself in trouble right quick. So I appreciate what you're saying though. It's like, that takes practice.
Crystal, you funny. She's like, when I don't like a question, I just ignore it. But that's true. You just stick to your.
That's exactly what you do. That's what all good politicians do. You just say, you get your point across on what you want to say. We are at 9 o'clock. This hour flew by. I just want to thank you all for joining us tonight. Danielle, do you want to say any last words before we close out, and next steps and next pieces in this work?
Yeah, sure. So tomorrow we're having a pep rally at 8:30 p.m. Eastern Standard Time. And this is where we're going to gather virtually, play some music, do some chants, have a roll call of each site, check in. I think Dr. McIntosh and Dr. James are leading that. So I don't know if you all want to share a little bit about the pep rally for tomorrow. Not to put you on the spot, but.
We're going to meet after this meeting to talk a little bit more about it, but come prepared, like you said, ready to jam and get hyped up for the rally, because that's what we need, right? We need to bring the energy and your passion.
Should they wear specific colors?
So we're asking people to rock red, white, and blue, and or scrub. So whichever one you have, I'm be rocking scrubs because that's just what I want to do.
Right. I mean, for the pep rally. Same colors.
Yeah. We keeping it patriotic, baby.
Okay. All
For
right.
the next 48 hours. And then someone asked about security at the rally. So each site, like the DC site is going to be at the US Capitol. So the Capitol Police will be around. Rochester, you all are also on Capitol grounds as well. So I think everybody has security around or easily accessible at their particular site. But good question.
All right. Well, thanks, y'all. Have a wonderful evening. Take care, and we'll see you tomorrow.
Thank you.
Thank you. Good night.
Thank you. Good night.
So yeah. Hello. You're on mute. Hello.
So